We now also have some disagreement from the CDC and the national nurses because the CDC has been not overly calm or dismissive of the threat from Ebola, but the CDC has been very specific, including CDC Director Thomas Frieden, who said last week, "I have no doubt we will stop this in its tracks in the US. But I also have no doubt that as long as the outbreak continues in Africa, we will have to be on our guard," also insisting that American hospitals are better stocked, have better isolation facilities, saying that public health officials have well-tested strategies to prevent the spread of these diseases. And Lewis, not everybody is completely on board with what CDC Director Frieden is saying. For example, the National Nurses United program has recently been polled, and they are not at all confident that the American healthcare system is ready to properly deal with the threat from Ebola. There are these updated preliminary results based on a survey of 700 RNs, registered nurses, at over 250 hospitals in 31 states. I'm just going to read you what they say, okay? And this is in direct conflict with what the CDC is telling us. Here we go. 80% of the surveyed nurses say that their hospital has not communicated to them any policy regarding potential admission of patients infected by Ebola. 87% say that their hospital has not provided education on Ebola with the ability for the nurses to interact and ask questions. 1/3 say that their hospital straight up has insufficient supplies of eye protection, including face shields or side shields with goggles and fluid-resistant gowns. 40% of the nurses surveyed say that their hospital does not have plans to equip isolation rooms with plastic-covered mattresses and pillows and to discard all linens after use. Less than 10% say they were aware that their hospital has such a plan in place, and more than 60% say that their particular hospital fails to reduce the number of patients they must care for to accommodate caring for an isolation patient. This is not good. And, it's not a question of which agency do we believe or not believe. The fact that there is this level of disagreement over the preparedness level is in and of itself concerning.
And this isn't surprising. Even without these bullet points here, I would have taken the word of the RNs over the word of someone from the CDC.
And why? Why is that?
Oh, because they're the ones on the ground. They're the ones who are actually actively dealing with these cases, or these, they're aware of what's happening in their hospitals. And not to sound like an ass, but, the director of the CDC is probably just sitting at a desk listening to what some of the people around him are telling him.
Presumably getting reports from people that are on the ground there. But as what you're pointing out, Lewis, is something that some others on the ground are feeling. I was just reading an article about a doctor who actually put on a hazmat suit and went to Atlanta airport, and the hazmat suit said on the back, "CDC is lying." That one individual, at least, feeling very strongly that the CDC is drastically understating the risk here. What do you think about this? Have you been following the reports from the CDC and those from the National Nurses United? Who do you believe on this? We'll see what the audience thinks, Lewis.